Hello, and thank you for joining this recorded public hearing for the Child Care and Development Fund, or CCDF, Draft State Plan for federal fiscal year 2022 through 2024. My name is Pam Thomas from the Office of Early Learning at the Department of Elementary and Secondary Education, and with me here today is Stephanie Chandler, the CCDF Program Administrator at the Department of Social Services. Together, we will be your facilitators today. We appreciate your interest in childcare and your time today to learn more about this plan. Before we begin, we wanted to give you an idea of what to expect in today's hearing. For some of you, this is the first time you've participated in a public hearing. And for others, you may have participated in a hearing before, and it may have been in a manner that's different than today's hearing. To clarify, the purpose of this public hearing is to collect comments from a variety of stakeholders. In this series of hearings, we will aim to hear from child care providers, family members, home visitors, educators, professionals who provide training, and other key stakeholders in Missouri's childhood system. You can email your comment to childcare@desi.mo.gov until 5 p.m. on Tuesday, June 1st. We also wanted to make sure that you have the link to where you can find the draft state plan that we'll be referencing throughout the public hearing today. The link to the draft document is displayed here on the screen. Please note, this is a lengthy document. It is well over 100 pages, and that's one of the reasons we wanted to take the time in this public hearing to give you an overview of the content and show you what to expect when you review the document. There are 8 categories or sections to the draft state plan. These 8 sections reflect the key functions of an integrated system of childcare for low-income working families. We will review the overall key topics or focus areas for each section, as well as the newsworthy notes. These notes will help identify anything that is new in the section, as well as anything that was added, removed, or changed. So this is just a high-level review of each section, but it should be helpful to see the changes here. In saying this, we also want to remind you that all comments submitted in the response to the draft state plan will be included in the public record. We would ask that you please refrain from conversational comments or general questions about topics that are not related to the content of the draft state plan. And no, the state will review and consider all comments that are made through the local public hearing process, including this recorded hearing, as well as the series of live local public hearings being held throughout the month of May 2021. Before we begin today, I wanted to give a few notes about the overarching purpose of the CCDF. I think this graphic here is helpful to show the relationship between the law, rule, and the state's plan. So first, the law. The Child Care and Development Block Grant, or CCDBG, Act of 2014 was reauthorized in 2014 and significantly revised the purposes of the CCDF program and requirements for states. Then the rule. In September 2016, the final rule was released, which makes regulatory changes to the CCDF program that's based on the law. Then the state's plan. The plan is the primary mechanism that the Administration for Children and Families, or ACF, uses to determine the state's compliance with the requirements of the law and the rule. I also want to clarify that the changes to the Act in 2014 and to the rule in 2016 were specifically made to strengthen the requirement for the state to protect the health and safety of children in child care, and to enhance the quality of care, to help parents make informed consumer choices, and now more than ever since the coronavirus pandemic, to support parents having information about child development and school readiness as part of an overall system to support young children. The intention is that the state and federal government use this information to track and assess the progress of childcare in our state and to determine the need for technical assistance. So, as you can see, the intent of this act, rule, and plan is quite broad. It's not just about childcare subsidy. It's about the bigger picture of early childhood in the state and how a strong childcare system is an important part of that. Before we begin the review of each section, I wanted to provide this overall note about the change in the lead agency for the state plan. As many of you know, Governor Mike Parson announced in January earlier this year that nearly all early childhood programs across state government will be consolidated in a single office that combines programs from Departments of Elementary and Secondary Education, or DESE, Health and Senior Services, and Social Services into the Office of Childhood housed at DESE. Currently, each state agency provides various services for children and families, and transition into one office will allow various childhood programs and activities across state government to become more streamlined and more effective. The new Office of Childhood will be in effect on August 28, 2021, but because the state plan will be effective on October 1st, DESE is identified as the lead agency who will administer the state plan. So we hope this information and background introduction provides you with some context for what to expect during the public hearing. And now we'll begin a review of each section. For each section we review, you will see a slide for the section focus. This is a quick look at the key content in the section, and we wanted to pull this out in a summary format to help you identify the content that's in the section. Here in Section 1, you'll find an overview of the leadership and coordination components for the state's child care system, including the required system and funding parts of the state plan. This is where you will find the details about the lead agency that I was just explaining on the last slide. In Section 1, you'll also find an overview of eligibility, various funding sources, and monitoring and quality activities. You'll also find an introduction to the important partners as it relates to the lead agency partnerships. If you're looking for the activities that led to the development of the draft plan, including this public hearing, you'll find that information in Section 1. And finally, information about the plan for disaster preparedness is in Section 1 as well. Also, for each section, we wanted to identify a few important things that were added, removed, or changed in the draft plan. Throughout the public hearing, we will refer to those items as newsworthy notes. For each section, we'll identify these major items and again, help you identify the content in each section. Throughout the section numbered 1.1, you will see that we updated the lead agency information that was mentioned earlier. And I also wanted to point out that this new plan includes a co-administrator, where we have designated someone specifically to help support the CCDF program administrator in the oversight of the plan. We recognize that this is a robust plan, and with the intent to be more broad in addressing the bigger picture of the child care system, we want to ensure we have adequate state support in the oversight of these many activities. Throughout Section 1.2, we updated CCDF activities conducted by the lead agency. The most remarkable change here is that eligibility determinations will continue to remain at the Department of Social Services as part of the combined application for state benefits that families complete through the Family Support Division. Throughout Section 1.3, we updated the activities conducted while developing the plan and holding local public hearings. Specifically in Section 1.4.1, you'll find here we updated the coordination with partners. A noticeable change here is that the programs that need to be in a coordination effort are now in the same agency. So for example, reference to programs serving children with disabilities through the Part C First Steps and Part B 619, or Early Childhood Special Education, of the Individuals with Disabilities Education Act, or IDEA. Those are now described as being housed in the same agency. And now I'll turn it over to Stephanie Chandler to provide an overview of Section 2.
Thanks, Pam. Hello, everyone. In Section 2, the state is asked to define what outreach and consumer education will look like. The state is required to support the role of the parent as a child care consumer and provide information to help parents make informed choices that fit the needs of their own family. To do so, the state must remove barriers so that families can receive the information and participate fully in the development of their child in child care settings. In this section, you will see how Missouri will design and deliver consumer education to be inclusive of parents receiving CCDF funds, the general public, and child care providers. Highlights of Section 2 include in Section 2.3.6. Since the last plan was submitted, Missouri began piloting a QAR, or Quality Assurance Report, with the goal of providing a continuous quality improvement process for early learning programs and to provide families with consumer education about the quality of early learning programs. In 2.4.1, DESE, in collaboration with the state's Child Care Resource and Referral Agency, is in the process of implementing a regional hub model. By 2023, regional hubs will be located throughout the state with a focus on supporting families with children birth to age 5 and improve access for Missouri's families and children. The ultimate goal of a regional hub model is a coordinated system of early care and education connections with a place for every family to access resources and services that promote safe and healthy learning environments for young children. In 2.5.1, the Missouri Milestones Matter pilot, which delivers training to child care providers on the importance of developmental monitoring and when to refer a family for a developmental screening, is in the process of scaling up to a statewide implementation, which will provide greater access to training on child development statewide for child care providers and home visitors. Throughout Section 2, locations for consumer education are noted, and as you can see, they are located on multiple websites that are in operation at the time of the drafting of this plan. With the opening of the new Office of Childhood, information will be moved to a new Office of Childhood website, making it easier for consumers to locate all relevant educational information. Since that website is not in operation at this time, Missouri will file an amendment to update the plan and reflect the new web pages after they are fully operational. This is scheduled to happen as the new office officially begins. The new website is being developed with the consumer in mind and will be easy to navigate for families and providers. Back to you, Pam.
Thanks, Stephanie. Here in Section 3, you will find information about the financial assistance provided to families. This is the section that you will want to review if you are looking for a definition and description of children and families who are eligible for child care subsidy and the manner in which families can help contribute to the cost of care. Also in Section 3, you will find information about access to increased supports for the state's most vulnerable children and families. And there's also information about how the child care system is providing continuity for working families who need child care. For Section 3, we wanted to alert you to a couple of newsworthy notes. In 3.1.2, we clarified the definitions for job training, education, and attending as part of the workforce section and continuity for working families. In Section 3.1.3, we updated the CCDF income eligibility limits for the current state median income, or SMI, that's based on the most recent data published by the Bureau of the Census in 2021. To clarify, both of these sections have updated information, but it's not necessarily brand new information to the plan. Okay, and I'll turn it over to Stephanie, who's going to provide an overview of Section 4.
Thanks, Pam. In Section 4, the state must identify how parent choice will be promoted and that working parents are empowered to make informed decisions that best suit the needs of their family, and that the choices available for families who receive CCDF subsidy are comparable to non-CCDF families. Lead agencies must employ strategies to increase the supply and to improve the quality of child care services, especially in underserved areas. In addition to generally building the supply of child care for all families, this effort also supports equal access for CCDF eligible children. Within each plan cycle, the state must analyze the current rate for child care statewide and use the data to identify the gaps between the cost of care and subsidy levels adopted by the state, and use the data to inform subsidy payment rates. The goal is for the payment rate to be at 75% of the current market rate for care. So in section 4.1.6, you will see that an infant-toddler specialist network has begun. There are 8 infant-toddler specialist network partners throughout the state. The Infant-Toddler Specialist Network is designed to increase caregivers and administrators' knowledge, promote community connection to increase awareness and use of available resources, and services that support healthy, safe, and nurturing care for infants and toddlers, and implement an efficient, accountable infant and toddler specialist system, and increase its capacity to offer services. This is implemented through on-site coaching and consultation, and delivers targeted training for caregivers and program administrators. In 4.1.7, to increase quality care, especially in areas that have significant poverty and unemployment, the lead agency is contracting with the Missouri Small Business Development Center, or the SBDC, to provide one-on-one counseling to business owners and directors to help support their finances. Additionally, online classes will be available to child care providers, directors, and owners on best practices. These services are free of charge and available across the entire state. In 4.2.1, in the draft, Missouri identified that a market rate survey was not conducted in 2020 as originally planned because data was not going to be reflective of a typical operation in the middle of a pandemic. Since the drafting of the waiver, state staff have received further clarification from the Federal Office of Child Care, who identified that a waiver was not necessary as the information could be included in the plan being drafted. Missouri has withdrawn the requested waiver and will add this clarification to the final plan. In section 4.3.1, you will see information about a potential simplified rate structure. Currently, Missouri has payment structures for part-time, half-time, and full-time care. Based on stakeholder feedback, the lead agency is looking for ways to collapse the definitions of care to a more provider-friendly model. This will require Missouri to submit an amendment to the plan with the definitions when the definitions have been decided. In section 4.4.1, you will see that Missouri is conducting 2 activities to pilot a system that pays for enrollment rather than attendance. Using Coronavirus Response and Relief Supplemental Appropriations Act, or CRRSA, CRRSA, the lead agency will pilot a program for foster children to ensure providers can immediately accept children in foster care when asked. Second, DESE, as the lead agency, will implement a payment system that provides a payment for enrollment. Enrollment will be defined as the total amount of units a child has been authorized to attend. There will be built-in checks and balances to ensure program integrity is maintained. Both of these activities will be executed by DESE as the lead agency as a pilot to test the viability for statewide implementation. And back to Pam.
All right, thanks, Stephanie. Moving on to Section 5, here is where you will find the details on the standards and processes used to monitor providers, specifically the licensing requirements that must be met, the ratios and group size requirements and standards for safety and health. Section 5 is also where you will find the qualifications and training requirements for child care providers. You will also find the information about required annual unannounced inspections for licensed CCDF child care center providers. And finally, Section 5 has the details around the policies and procedures for monitoring and enforcement, which includes required background checks. In this Section 5 for licensing regulations, there are no newsworthy notes for significant changes in the area of licensing and regulations. Of course, website and statute numbers were all reviewed and updated, but otherwise the content aligns with your current practice. However, I wanted to take this opportunity to remind you that in the last reauthorization of the law, or the CCDBG Act of 2014, there were 6 new requirements for child care providers, and you can see those on your screen here. Requirements from health and safety standards to ongoing training to qualifications for licensing inspectors and required background checks. The content for the standards and licensing requirements in this section are aligned with these requirements that you've likely seen over the past few years due to the change in the law. And now back to you, Stephanie, to share more about Section 6.
Thanks, Pam. In Section 6, the state must show how a qualified and effective child care workforce will be recruited, trained, and retained. This section will focus on the professional development framework, ongoing professional development and training, and post-secondary education for caregivers and administrators that work with children from infants through school age. This framework is part of a broader systematic approach building on health and safety training within the state. The state must incorporate their knowledge and application of health and safety standards, early learning guidelines, responses to challenging behavior, and the engagement of families. Additionally, the state is required to develop, maintain, or implement early learning and developmental guidelines that are appropriate for Missouri's children in a forward progression from birth to kindergarten entry, describing what children should know and be able to do, and covering the essential domains of early childhood development. These early learning and developmental guidelines are to be used statewide by child care providers and in the development and implementation of training and professional development. In 6.1.1, the lead agency has stated that it is in the process of acquiring an updated registry that will combine the features of a workforce registry and training calendar into a single system for increased efficiency and improved access for a variety of professionals, including childcare, preschool, parents as teachers, and home visiting. Also in Section 6.1.1, as part of a sustainability plan, the lead agency is able to use funding from the Preschool Development Grant as well as CCDF funds to develop and support more in-person and online on-demand training opportunities for providers across early childhood and after-school programs that will include not only increased training topics, but increased access to training, reduced cost, and provider training across the difficulty levels needed based on education and years of experience from the entry-level individual to the veteran. Lastly, in this section, Missouri received a national funding opportunity from 0 to 3, which will be used to continue the work began under the Preschool Development Grant that brought together the Workforce Advisory Council and a higher education task force to understand the current status of the early childhood workforce, identify resources and needs, and create career pathways. In Section 6.2.6, to strengthen business practices, the lead agency is contracting with the Missouri Small Business Development Center, the SBDC, to provide one-on-one counseling to business owners and directors to help support their finances. Additionally, as part of the preschool development birth to 5 activities, the lead agency is conducting a pilot project in 2021 to support approximately 15 center directors and administrators as scholarship recipients in a master's level leadership model as part of the continuum of opportunities for education and training through Teach Missouri. This model will include learning sound business practices, how to deal with business situations quickly and in a manner that is likely to lead to a good outcome, such as developing business acumen, and improved financial performance and leadership development. In section 6.3.1, to increase training opportunities, the lead agency is contracting with a university or training network to develop online, on-demand, interactive health and safety trainings that are aligned with the core competencies, increasing levels of aptitude. Additionally, in order to assist childcare staff in meeting challenging behaviors, the lead agency provides childcare centers with training in Trauma Smart. Trauma Smart is an evidence-based intervention that is recognized by the U.S. Department of Health and Human Services and the National Child Traumatic Stress Network to be effective in helping children and the adults who care for them address the negative impact of violence and trauma. And now, back to Pam to begin section 7.
Okay, thanks, Stephanie. Here in section 7, you will find the continuous improvement and quality initiatives for the child care system. This includes any quality rating system efforts and any other quality improvement initiatives specifically for infants and toddlers. In section 7 is a description of the resource and referral activities specific to the child care system, as well as accreditation support. Also in section 7 is the development and usage of high-quality program standards relating to health, mental health, nutrition, physical activity, and physical development. And then last but certainly not least, an important feature of the broader system is the evaluation and assessment of quality and determining the effectiveness of all of these child care services. This is becoming something that is more important each year, that we identify and utilize an evaluation measure for the work that we do. Not just the number of children and families served or the number of trainings provided, but also a measure of effectiveness. Did the service make a difference? Did the training do what it was intended to do? These are important questions we must weave into the work to make sure that we are making the best impact we can with these state and federal dollars. For section 7, we wanted to alert you to a couple of newsworthy notes. In section 7.1.1, we clarified some of the needs assessment activities that are completed not only for child care, but also for other childhood programs. In section 7.1.2, you'll find additional information about the change in lead agency for the implementation of the upcoming plan, again effective October 1. In 7.2.1, we updated the funding types based on the designation of a new lead agency. And finally, throughout sections 7.8 and 7.10, we updated multiple data points related to accreditation and parent link services aimed at supporting quality programs. And now one more time, I'll send it back to Stephanie to provide an overview of section 8, which is our last section in the plan.
Okay. Program integrity and accountability activities are integral to the effective administration of the CCDF program. In section 8, the lead agency must describe how it will ensure integrity and accountability while maintaining the continuity of service. In Missouri, there are a number of internal and external measures in place so that a system of checks and balances ensures that CCDF funds are expended appropriately, timely, and with minimal error. Additionally, there are processes in place to correct errors in a timely manner to minimize the impact to providers. The lead agency will be reviewing and potentially updating the online on-demand subsidy orientation training that providers must take to enter into an agreement to accept subsidy. System reviews will regularly occur to ensure the utmost level of accuracy and integrity is maintained. Accountability at all levels will ensure that CCDF provides maximum impact for Missouri. Also, in 8.1.6, during the transition and implementation of the new Office of Childhood, the Department of Social Services and the Department of Elementary and Secondary Education will work together as responsible agencies for pursuing issues of fraud and overpayment. The lead agency refers any cases of improper payment that appear to be as a possible result of fraud to the Welfare Investigations Unit, the WIU. Within the Department of Social Services, Division of Legal Services for investigation. The WIU will investigate the case and determine if fraud can be identified for prosecution, or if there is an intentional program violation that can be identified for recovery. The lead agency is developing an MOU with the Department of Social Services, WIU, to ensure all fraud, whether committed by an eligible family or participating provider for any welfare program, such as TANF, SNAP, Medicaid, and child care, is investigated. And back to Pam to wrap it up.
All right, thanks, Stephanie. I just wanted to share another reminder that the draft state plan is available online at the link displayed here on your screen. If you have a comment you would like to submit for consideration, please send that to us at childcare@desi.mo.gov. Remember, the deadline for all comments is 5 p.m. on Tuesday, June 1st. And this concludes the recorded public hearing information. Thank you for participating today.